and welcome to Business Connections, a program produced by the Dayton Area Chamber of Commerce. I'm Holly Allen, Director of Marketing and Communications for the Dayton Area Chamber of Commerce. It seems like in the state of Ohio, we've been talking about marijuana forever. In fact, it has been a while. In November of 2015, 64% of Ohio voters turned down a proposal put on the ballot by Responsible Ohio. And this would have legalized recreational and medical marijuana by allowing 10 named growers to grow, distribute, and sell marijuana in our state. Now, Issue 3, as it was known, was unsuccessful as a ballot initiative, but it did start quite a conversation about marijuana and legalizing it in the state of Ohio. And that has caused the wheels to start turning in the State House. There's been a lot of action in this issue at the Ohio State House, and that's what we're talking about today. We have two guests with us, State Representative Steve Huffman of Tip City, who is also a medical doctor, and Chris Kershner, who's the Vice President of Economic and Workforce Development at the Dayton Area Chamber of Commerce. I want to thank you both for being with us today, and as I told you earlier, I'm fighting a cold, so I'm going to let you guys kind of take this one away today. We're talking about medical marijuana because, again, Issue 3 kind of went by the wayside. It was a large failure. I think we can all agree on that. But we've seen a lot of action happening. Representative Huffman, it's been quite an exciting spring for you. Can you tell us about the latest medical marijuana initiative? This is known as House Bill 523. You were the primary sponsor.
Yes.
How did this come about? What's the status right now?
Well, if I go back to the beginning, that Speaker Rosenberger looked at the ballot initiative, Issue 3 last year, and said it polled at 80 to 90% to approve medical marijuana, and that's what the people of Ohio wanted. But in my belief is that it failed because of the monopoly in homegrown and the recreational. And so Speaker Rosenberger put together marijuana task force last winter, which I was part of, and it was represented by the state chamber, the NFIB, trade, advocates for, and actually the principals of Issue 3, Jimmy Gould and their attorney was on the task force. We heard about 100 witnesses over 23 hours and got a lot of information, and then that's where House Bill 523 came out of, that I was the principal sponsor of. Came out in January. A number of more hearings and some revisions, and it's waiting the governor's signature at this point.
So it's pretty close.
Yes.
To becoming reality. Did you think it would get that far?
I was confident that we were doing what I think in Columbus, if you do what's right for the people and what the people want, the job will get done. So I was confident in the end that it would be a reality.
You mentioned Issue 3 would have legalized both recreational and medical marijuana. House Bill 523 is for medical marijuana. Can you spell out what this bill would legalize, what it would mean for the people of Ohio?
Sure. You know, it's truly focused on the patient, and besides what it legalizes, what it doesn't legalize is I think is a key. So it would set up the Medical Marijuana Control Commission, similar to the liquor control. 13 people that would be appointed within 30 days of the governor signing the bill. They're appointed by the governor, the president of the Senate, Speaker of the House, minority leader in both chambers. Would include physicians, pharmacists, horticulturists, other people concerned with medical marijuana. Then they would start making rules on how to grow, where to grow, how to distribution, manufacturing, testing of medical marijuana. It would come from a recommendation from a physician, and only a physician, not a nurse practitioner or a physician assistant. They have to have an ongoing relationship with the patient that they recommend medical marijuana. So you can't just walk into an emergency room or anything and get medical marijuana. There's about 15 conditions, including seizures, multiple sclerosis, chronic pain, that you could use it for. We believe the commission is going to take about a year to 18 months. The Control Commission, when they're making decisions concerning medical and pharmacy, would have to get the input from the Ohio State Pharmacy and Medical Board.
Would any physician be able to give this recommendation, or will there be specific physicians who are able to do that?
There will be a license or certification with the Ohio State Medical Board that you would be able to recommend it with added education and training. The other things that this bill does not do is there is no homegrown. You cannot grow your own. There's no other product or medicine that I know of that you grow yourself at home. So there would be no homegrown, and the basis of that is, to me, that's pseudo-recreational. So if you grow 10 plants, people will sell 2, they'll give 2 away, somebody will take 2, and so there's no homegrown, and you cannot, in the state of Ohio, smoke medical marijuana for medical purposes in this bill.
Okay, so only edibles. Is that true?
Edibles, you can vapor, similar to an
Okay.
e-cigarette, and also, which is very commonly used for seizures and neurological conditions, is an oil.
Okay, interesting. Chris, I want to ask you about the Dayton Area Chamber of Commerce, of course, was very vocal against issue 3. It formed the DREAM Coalition, which is Dayton Regional Employers Against Marijuana. Where does the chamber stand on this House Bill 523?
Yeah, it's been an exciting year, Holly. So last fall, actually last summer, the Dayton Area Chamber of Commerce came out with the DREAM Coalition, and we were one of the first business organizations in the entire state, and actually led the business community for the state of Ohio in our opposition to issue 3, which would have legalized both recreational and medical marijuana in the state of Ohio. That voice was heard very loud, and we defeated the issue, as you mentioned earlier, almost 65 to 35 last fall. Since then, the DREAM Coalition really ceased to exist. It was formed for the purposes of issue 3, and it was dissolved after issue 3 was defeated and the coalition was successful. So going into 2016, and as medical marijuana was considered, the DREAM Coalition was really, I would say, we didn't have an official stance. This coalition ceased to exist, but the business community in the Dayton area, they're probably leaning more towards the opposition side of medical marijuana, because they wanted to make sure the right employer protections were in place. But I'll tell you, we ended up in that neutral position, and here's why. The business community really, when we looked at what we needed to revitalize Ohio's economy or to help stimulate business growth or to grow jobs, passing a medical marijuana bill really was not the tip of the iceberg. That was not one of the crucial points we needed to help improve Ohio's economy. So it really wasn't our bill. It wasn't something we were heavily advocating for as a business community. It wasn't something that businesses were coming to me every day saying, man, only if we had medical marijuana, I could solve all my employment problems and I could open up that second business and expand my operations. It really wasn't their issue. So what our position at the chamber was, we wanted to ensure that there were the right protections put into any medical marijuana bill that for the employment community. We want to make sure employers could operate their business as they operate it today. If they want to have a drug-free workplace policy, they can have a drug-free workplace policy. If somebody's impaired on the job and they feel like they need to take action, they can take action free of any kind of legal lawsuits that would come after them. If somebody was impaired on the job and gets hurt, we wanted to make sure that they wouldn't be able to seek workers' compensation benefits in the state of Ohio because they were abusing medical marijuana, and that is the case. We also want to make sure if somebody was let go of their job, that they weren't able to have unemployment benefits if they were let go because of just cause, and because of that just cause being a violation of a drug-free workplace policy. All of that was put into House Bill 523, championed by Representative Huffman and the Ohio House of Representatives. They put all those employer protections in and really ensured that this bill would not hurt the business community. And that got us from really leaning towards that opposition stance we had on issue 3 going into 2016. That brought us more and neutralized us, really. Put us in more of that neutral stance. I don't think we would have ever gotten to a full position of endorsing or advocating for it, because, like I said, it wasn't our bill. It wasn't our bill. But they put all those employer protections in place and ensured that the business community would be able to continue to operate as they do today. Then that made this bill really a neutral piece of legislation for the business community. There's business folks out there that may be for or against it still, based on their own personal beliefs on whether they think medical marijuana is effective treatment for patients or not, and that's, we can all have that conversation when we're having a glass of wine in the evenings if we want. But as far as businesses are concerned, there really was not it was a neutral bill for the business community.
And that really was the difference, right, between issue 3, that in this case, the business community and others had a seat at the table when we were discussing how to put this together. Is that right? Representative Huffman, can you talk about how this process for House Bill 523 differed from the process of issue 3 getting to the ballot? How are those two pieces, those two initiatives different, how they get before the state of Ohio?
Issue 3 came by a ballot initiative, and basically the 10 gentlemen that were going to financially benefit from issue 3, who was going to basically have a monopoly and the only 10 people that could grow marijuana, and financed it and got the signatures to be on the ballot. So it was driven by a few people that were going to financially benefit. This was driven by Speaker Rosenberger and myself, Kershner, representative from the Canton area, and Representative Ramos from Lorain. And we were on the task force, and we listened to the people. And I think that is the big difference, is that, as I said before, 80 to 90% of the people of Ohio, if you ask them one question, do you think we should have medical marijuana in Ohio? They say yes. And so we wanted to get it right and to have those restrictions. One thing that I didn't mention, I think is a very good clause in the bill, is local control. So if the city of Dayton, city of Troy, any jurisdiction decides we do not want growers, we don't want dispensers, we do not want manufacturers in our jurisdiction, they can vote, and that's not going to happen in their jurisdiction. So there's local control, and people can decide where it's at. Also in there, you cannot have it within 500 feet of a daycare center or school, which is good. And there's also some other provisions that right now, medical marijuana is a Scheduled 1 drug. In there, we encourage the federal government to change it to Schedule 2 because there is legitimate uses for medical marijuana.
Chris, from a business perspective, can you talk about that difference, having the legislature and this House bill kind of control the wording and go through that process versus issue 3, where Responsible Ohio essentially wrote it, and talk about the difference between how that was a constitutional amendment versus what we have here in a bill?
Yeah, absolutely. Yeah, issue 3 was a constitutional amendment. Would have put a monopoly in the state constitution and would have legalized recreational medical marijuana. Our chamber and the business community really spoke loudly and said, we don't think the Constitution should be used for those types of initiatives. I mean, the state Constitution grants people the right to vote. It prohibits slavery. And oh, by the way, it could also legalize marijuana. We just didn't view that that was the right place for this to be legalized, in addition to the monopoly and a lot of other things that were wrong with issue 3. We believe that the General Assembly and putting this into the Ohio Revised Code through the General Assembly process is absolutely the right place for an issue like this to be considered. That was an overwhelming thought from the business community. If this is going to be done, it has to be done through the General Assembly. That way it can change, it can evolve. The legislative process, we have a full-time legislature in Ohio, and they're always meeting and discussing and trying to figure out what is the best laws for Ohio to be, what are the best laws to be passed or not be passed for the state of Ohio. And this can now, as this is passing, and it's June right now, I know the program will be airing in July, so this may or may not be signed by the governor by July, but if it's signed by the governor and is in law, it could still change and evolve over time. If we realize down the road that we missed something in this bill, the legislature can make that change. If we realize that something was done wrong in the bill, we can delete that. It can evolve as the state evolves and as medical marijuana evolves in the state of Ohio. And we really believe that's the right place for this to be considered, and we commend the legislature for taking this up. Regarding the process, one thing I wanted to mention was the medical marijuana task force that Representative Huffman and others sat on. Phil Parker from the Dayton Area Chamber of Commerce, our CEO, testified to that task force to let them know what are some of those key provisions that the business community wanted to see in place. We outlined all those issues that we talked about earlier regarding workers' compensation, unemployment benefits, drug-free workplace, legal action against employers, employers still being able to do drug screenings. All of those issues were brought up to the medical marijuana task force by Phil Parker from the Dayton Area Chamber of Commerce, and we were very happy to see that those thoughts were taken very seriously, and they were all put in this bill to make sure it did not negatively impact employers.
Representative Huffman, I would talk a little bit about where we go forward here. You said that it's essentially sitting in front of Governor Kasich, and he can choose to sign or not sign. But is it true that this is not the only initiative that's kind of hanging in the balance for the state of Ohio? Can you talk about what other initiatives are out there and what the future might look like?
Well, in the General Assembly, this was it, but there was an organization called MPP, Marijuana Policy Project, and they were collecting signatures for a ballot initiative, and they had till sometime in July to get 300,000 some. And on Saturday, we were very happy to find out that they are no longer getting signatures and that they're not going to seek a ballot initiative. And I agree with Chris, is that this place, medical marijuana is in the revised code. And as Representative Sherian always tells me, revised code means we can change it. Mm-hmm. Constitutional amendment, a ballot initiative can never be changed. And you know, maybe we learned from the casinos that the people of Ohio were asking for casinos and wanted casinos, and the General Assembly wouldn't do it, and we got a ballot initiative, and you know, as Speaker Rosenberg said, we were elected to lead, and that's what we did on this issue.
Okay, so there is no other initiative. The one that ended the end of May here, was that the only one? Was there another one?
There's one other one, and maybe Representative Huffman can help shine some light on it. But there's one other one I'm aware of, but honestly, I don't know who's backing it. It is one that was actually submitted to the Ohio Secretary of State's office by a law firm in Columbus. I believe it's called the Industrial Cannabis and Hemp Amendment. The language was certified by the Attorney General, and they're out collecting signatures as well. We're not for sure how serious that proposal is. From my perspective, we don't know for sure who's backing it or what kind of funding they have, but that one still is out there. Okay. They haven't withdrawn it yet, unless Representative Huffman, do you know any more than?
Your understanding is mine, is it's out there. We don't know who the principals are and how active they are currently doing this.
Okay, so what would happen if House Bill 523 were to be signed by the governor? Would any ballot initiative just kind of fall by the wayside, or if it was less restrictive, could they move forward? How would that work?
A ballot initiative can always go forward, and it would be the law and the Constitution. It would trump anything that we did in the General Assembly.
Okay, that's good to know.
Yeah, I mean, really the two biggest initiatives was House Bill 523 that Representative Huffman, Speaker Rosenberg, and the House championed, and then the Marijuana Policy Project ballot initiative.
Right.
You know, the Marijuana Policy Project has withdrawn their amendment because of House Bill 523's passage. So those really were the two vehicles, and both of those are coming to a completion. The other one that's still out there, we're really unsure of it. We just don't know if it has legs to continue to move forward. And I'm hearing from folks in the business community and in the Dayton region that they're not really confident that it's going to go forward either. So I don't think we're keeping an eye on it. You know, right. As a good public policy professional, I always sleep with one eye open to see who's working on initiatives out there. But we're not confident that it's going to move forward and have much success.
Okay.
So. And I say that even if they do, here's the alternative. The people of Ohio can choose. They can choose, you know, House Bill 523 with the limitations that's based on the patient, or they can, whatever the ballot initiative says, with homegrowns and pseudo-recreational or recreational, they'll have something to choose from, and I am confident that the people of Ohio will choose House Bill 523 and what it does for Ohio.
It really was the best opportunity if medical marijuana is going to get passed in the state of Ohio. This bill was done the right way. It was done the right way that ensured that, you know, I shouldn't say it ensured there will be no abuse. There's always abuse. There's abuse with prescription drugs as they are now. There's abuse with alcohol as there is now. And it's sad, but it's the state we live in. And I'm sure there will be abuse under this one. I'm naive if I think there'll be zero abuse. But they put a lot of limitations in there that really tried to curb that type of abuse by not allowing home grow, not allowing smokables, by having reporting requirements for doctors as well as patients, that all that is going to be monitored through a state database. And I'm not a medical professional, but I think it's going to be similar to when you go to get certain cold medicines and they scan your license at the pharmacy and they're monitoring to see if you are abusing those medicines or not abusing those medicines.
Right, right.
And that's going to happen here as well. But the doctors are also going to be monitored so to ensure that there isn't a doctor who is abusing the law as well and writing scripts for patients he or she shouldn't be writing scripts for, or sorry, recommendations for patients that he or she shouldn't be writing recommendations for.
Right.
So those were all good provisions that were put in place to really help curb any abuse that's out there. I should also mention, the Dayton Chamber really stepped back from the medical argument of medical marijuana. We had a lot of discussions with members, with board members, with folks in the business community, and we really made a conscious decision that we're not medical professionals, and whether this is the right thing to be used to treat certain medical conditions is not our argument. We're not the professionals in the healthcare community. Folks with medical degrees, folks, our hospitals, other doctors in town, those are the professionals that can really judge the medical efficacy of medical marijuana and if it should be used for their patients or not. So we really took a step back on that discussion, and we really focused on employer protections, making sure the business community is protected, because the last thing we want to do is hurt our business community who is investing their time and money and talent into growing their business. It takes a lot of risk to grow a business anywhere. And we want to make sure that they have all the opportunities for success that they can, and that isn't hindered by bad policies that are passed.
Right. Speaking of our business community, let's say the governor signs this tomorrow, first week of June. What should they be doing, if anything, to prepare for changes once this goes into effect? Do they need to look at their policies? Whoever wants to take that question, Chris?
Sure, I can start off. Sure. Yeah. Employers should absolutely look at their internal HR policies, and first employers need to decide what they want to allow and what they want to disallow. Folks have generally already done that under our current state of affairs, but the state of affairs is changing. We now are legalizing something in the state of Ohio regarding for medical marijuana. You may need to make adjustments to your HR policies to decide if you are going to have a drug-free workplace, not have a drug-free workplace, what you're going to allow or what you're going to disallow, and make sure that's very clear and that's communicated to your employees. As employers, you need to make sure you have the best possible HR policies in place so you can operate your business. I'm not one to say whether you should allow or shouldn't allow medical marijuana in your business. That's up to you as an employer to make that decision. But you need to make sure that it's clear on what you want to do and that is properly communicated. If you want to continue to have a drug-free workplace, you absolutely can continue to have a drug-free workplace. If you want to do random drug screenings, you can continue to do random drug screenings. And those were important things the business community wanted to make sure was in this bill. And those things were put in place, and so the employment community has options. They have options on how they want to move forward from here on engaging on the medical marijuana usage in their workplace. Some employers we've talked to said, we may allow it. Others said, absolutely no, we're going to continue to have a 100% drug-free workplace, no exceptions. And either of those employers could have success in this type of environment with this bill.
And I would say the same thing. I would say before House Bill 523 and after, a good handbook and a good policy that is very clear and understood by the employee and the employer. And I don't think this is going to change very much for the employers, but I would, like I said, have a strong policy that everybody knows.
Okay. And let's say same scenario, the governor signs it next week. Will just your everyday Joe in the state of Ohio notice any differences? Will there be differences in the pharmacy? Will there be differences at the doctor's office? Or do we know yet?
I don't know, but I don't think there will. I think that there'll be a limited number of physicians that will recommend it. And I also think that you will not get it at a pharmacy, you will get it at a dispensary. Okay. And probably that is the only product they'll be selling. And I think there'll be a limited number around the state. And it all depends on what the Control Commission decides as a rule.
Any final thoughts from either of you?
Well, I'm just really proud that Speaker Rosenberger let me lead on this issue, and I appreciate what was done in the House. All the patients, advocates, and business community that came to Columbus and testified before the committee and before the task force to really make this what it is today. And I think that going forward, I think this will be the model for the last 24 states here in the United States to have medical marijuana. Most people believe the FDA will change it from a Schedule 1 to a Schedule 2 here soon, so that there can be more conversation and discussion. And this bill was all about the patient.
Mm-hmm. Well, we thank you for your hard work on this issue. Any final words from you, Mr. Kershner?
We appreciate the legislature taking the recommendations and comments from the business community seriously. We wanted, like I said earlier, we need to make sure the employment community is protected. And when the bill was introduced in the House, a lot of those employer protections were put in place. They added some more in as it went through the legislative process in the House, and really ensured that the businesses would still be able to operate as they do now. So we commend Representative Huffman and Speaker Rosenberger and their team on putting those in place. They made our job easy this time around, so we appreciate that. That's right.
Well, thank you both for being with us today. We appreciate your time, and thank you for being with us. This is Business Connections, and I'm Holly Allen, Director of Marketing and Communications with the Dayton Area Chamber of Commerce. If you want to know more about what you heard today or about what the Chamber does in our community, you can always go to DaytonChamber.org, and be sure to follow us on Facebook, Twitter, and LinkedIn. Have a great day.
The subject of marijuana use in Ohio just stays on the radar screen month after month. I'm not sure if we will suffer from marijuana fatigue, but we now have some new actions taken by our Ohio legislature that may resolve this issue, at least for now. Today's guests have discussed parts of the work done as of late by the Ohio House and Senate to develop a legislative answer to the medical pot issue. Last year's issue 3 was so bad, so ill-conceived, and so self-serving that Ohio voters rejected it almost 2-1 against. But along the way, citizens spoke of the need for medicinal marijuana for certain severe pain or chronic conditions that other medications could not treat. I don't pretend to know all the nuances of medicinal marijuana, but I do know this. Employers are very concerned for the safety of their employees, the public, and litigation against their companies if employees are using this drug while actively employed. Let me first clarify, this is not a chamber issue. We did not ask for pro-marijuana legislation or referendums to the state's constitution. If, however, this drug should be used by more of Ohio's citizens, especially workers, employers should demand safeguards that will protect them and their employees from misuse. We believe this public policy is best handled by our legislators after plenty of debate and testimony by all parties, including and especially doctors and healthcare professionals and employers. If medical marijuana is right for Ohio, then state legislation can handle it. We don't need further self-serving laws written into our Constitution that could severely hamper any further efforts to correct unintended consequences. This is not an easy issue to support, but I trust this bipartisan effort to allow medical use for those afflicted by severe health issues versus all-out recreational use to be best decided by our elected leaders and healthcare professionals.